Alrighty, so I'm back here in one of our chiropractic adjusting suites. And what I'm doing right now is I'm actually sitting on one of our very high-tech, sophisticated chiropractic adjusting tables. What does this have to do with hip pain? I will tell you that the majority of people that we examine in our office who have chronicity of posture, whether that's somebody who works on their feet all day long, maybe they work in the grocery store or in a factory, or people who sit a lot because they drive, or people who sit a lot at desks, those people have significant issues a lot of times with their pelvic alignment. And when your pelvis and your hips are sitting off kilter rather than nice and horizontal and level, what happens is you put awkward spots of pressure through your hips, your pelvis, even your lower back. That's very disruptive to the normal kinetic or movement patterns of that area, and it causes premature degeneration in many spots. It can cause nerve pressure, it can cause muscle asymmetry issues, it can cause ligament asymmetry issues, it can cause abnormal load to go through your hips. If you're using one hip significantly more than another hip on a day-to-day basis, you're going to end up with premature degeneration in that area, and you're ultimately going to end up on a pathway to having something like a hip replacement be needed. Keeping your spine and your pelvis and your extremities in proper alignment is one of the greatest ways that you are going to be able to keep function normalized, as well as being able to make sure that you ward off the likelihood of many of these different procedures that people are having nowadays, whether it's hip replacements, knee replacements, all those different things. When you couple that with active participation, doing spinal stabilization and pelvic stabilization types of exercises, you're going to have a really good success at making sure your structure stays strong and that you can stay strong and healthy and avoid many of the pitfalls associated with hip dysfunction in our society.